So I am here with Professor David Sebag Montefiore, Professor of Clinical Oncology at Leeds University and the Leeds Cancer Centre, who's going to tell us a bit about what his job role entails.
So I'm a clinical oncologist and I specialise in the treatment using radiotherapy for patients with different forms of cancer. And I lead a research group which was founded in January of 2012 that has gradually grown over the last 5 years and now has more than 20 members. So by leading that group, it is a great privilege to see a lot of the opportunities to develop and for us to receive funding to do all forms of research in different areas of cancer here in Leeds.
So in terms of radiotherapy research, what were the highlights of 2017?
So what I'd like to particularly pick out is to do with a relatively rare disease. So patients who develop a cancer at the lowest end of their bowel have anal cancer, which is a rare disease which is increasingly very successfully treated with a combination of radiotherapy and chemotherapy. And what I set out to do with a number of colleagues from around the country was to design a set of clinical research studies or clinical trials that were designed to try and work out the best dose of radiotherapy to successfully treat the patient's cancers, to maximise the chances of them being cured and to have the lowest level of side effects. So we set out to do this research as a team, and it's a great privilege to work with a number of researchers around the country, based in Oxford, Mount Vernon in London, Brighton, Manchester and Cardiff, and we put together a big team working with Leeds Clinical Trial Unit to design these clinical trials. And the actual name of the clinical trial approach is PLATO, and PLATO stands for Personalising Radiotherapy Dose in Anal Cancer. So we've been funded to do this research by Cancer Research UK, and we opened the clinical trial to recruitment in January of this year. And I'm pleased to say we have now 61 patients enrolled into the study, and this provides a great opportunity for patients who are interested in participating in research. And we deliberately set out to design an approach where, according to the actual size of the tumour that was present, there would be an appropriate clinical trial that the patient could consider and to decide whether they wanted to participate. It's sometimes the case that clinical trials have a limited opportunity for patients where they have to be of a certain size of tumour, certain results in their blood tests, and sometimes we disappoint patients by not having a clinical trial option available for them. But we set out when we designed PLATO to try and have a clinical trial opportunity that patients could participate in across the whole spectrum of the disease at presentation. So it's been really encouraging to see how we've gradually increased the number of hospitals are open to recruiting patients, and we now have 14 sites around the UK, including Leeds, that are actually recruiting patients into these clinical trials. And we think this is a fantastic opportunity to try and improve treatment for all our patients.
So what are your goals for 2018? What will the developments be on PLATO?
So as well as doing the clinical studies that I've just described, we were also fortunate to receive further funding from Cancer Research UK a few months ago. And what we're going to use that funding for is, with patients' permission, to do additional blood tests during their treatment. And we think it may be possible that the blood tests could indicate how well patients' cancers are responding to treatment, and also be able to indicate if there is any evidence of the cancer returning at the earliest stage. At the moment, we have to rely on sophisticated scans, such as an MRI scan, which can be both expensive, uncomfortable, and noisy for patients to go through. And we're interested in the research being able to help us decide whether in the future blood test might be able to find out those answers without having to do the scans. Now, that's not the case yet, but I think it's a really exciting and important opportunity that this research may actually lead to us being able to do that in the future. So I think we will be able to do even more for our patients by conducting this important blood test study in patients who are participating in Plato.
Thanks, David. We look forward to hearing the outcome of that study, and have a great Christmas.
Thank you very much.